Hi, I'm Manoj. I'm the CEO of CARE India. CARE is a global humanitarian confederation operating in 100 countries currently. In India, CARE has started its operation almost 7 decades back. Currently, we have a rich portfolio of programs in health, education, livelihoods, and disaster management, reaching out to the most marginalized women and girls in the country. And currently, in 14 states where we work, we directly reach out to almost like 38 million population. CARE has been at the forefront of many humanitarian challenges that India faced, be it the tsunami, be it the earthquake, and the recent floods which has been encountering in various states of the country. So COVID actually has been an area which we have decided to really work collaboratively with governments and other civil society organizations to have a multidimensional response at scale. So COVID truly is a multidimensional humanitarian crisis. It has a health crisis, it has an economic crisis within the overall broader humanitarian context. And CARE has decided to really work very closely on three key elements. The first element is the work that we are doing actually in Bihar. CARE has been working very closely with government of Bihar in maternal newborn care program over the last 10 years. So this program actually has almost like 1500 people from CARE deployed on ground at various levels. So this program will work very closely with WHO, UNICEF and government of Bihar in terms of immediately rolling out a health system response for the COVID. So the response is already underway with significant element of community support, facility support, and the broader policy support needed for really meeting the challenge of COVID. And this entire program is supported by Bill and Melinda Gates Foundation. The second element that's part of our comprehensive response is the support to the migrant workers. We all know that migrant workers have been significantly displaced because of the economic lockdown and they are facing serious challenges to their livelihood. With their migration back to the states where they come from, it is really cascading into a larger livelihood crisis in urban as well in the rural areas. So, what we intend to do is to work closely with the administration and provide the migrant workers immediate support in terms of their dry ration and the protective equipment needed for them to ensure that they get protected from COVID. And then eventually it will cascade into a broader livelihood support program which we will offer to the farming communities as well the migrant laborer communities to really rebuild their own livelihoods. Third element of our response is very focused on ensuring that frontline workers, be it the healthcare worker, be it the police, be it the sanitation workers, they have access to all the protective equipment needed for them to stay protected from COVID 19. It could be having the mask, it could be having the sanitizers, and all that being made available at the time when it is actually needed, and also have them educated on the need to really use that preventive measures consistently to stay protected from COVID. So we started this response work in many states of the country, and we are working very closely with the district administration and other civil society organizations in terms of rolling out the services as we are now all having the national lockdown situation, and we are getting excellent cooperation from the district administrations and other organizations in ensuring that the services are reached out to migrant workers and the frontline workers for the COVID response. We are currently challenged with a significant resource gap to meet the needs articulated by various states. So we need actually support from broad base of corporate organizations and individual donors to support our initiatives. So we really look forward to receiving the donation from you to really sustain and amplify our work to another level where the benefits that we have by virtue of the response program reaches to a much larger population as what it is needed in the country today. I'm sure COVID is possibly at the early stage of the challenge in countries like India, and we have to be really prepared for a long battle with COVID. And I'm sure that with all your support, and together we are able to really have a concerted response and we are able to really defeat the COVID-19. Thank you very much.